And as COVID cases climb, some hospitals are getting overwhelmed with patients.
And it's not just the hospitals being impacted. Ambulance companies are also seeing a spike in people who are now using their services.
But as Channel 3 Eyewitness News reporter Aaron Edwards explains, it's not always for the right reasons.
Emergency personnel across the state are overwhelmed with COVID cases, but officials say something that's taking up time and resources are patients going to the hospital and calling ambulances just to get a COVID test.
It just is congesting the emergency rooms significantly.
President of Emergency Resource Management in Manchester, Bob Ziegler, explains if you have COVID and are having severe difficulty breathing or chest pains, you should seek medical attention. But calling 911 or going to the hospital for a COVID test is only clogging resources.
People don't understand that 911 is we don't come to take COVID tests for you, and we're not there to take you to the hospital to get a COVID test.
Healthcare officials say some patients believe that if they take an ambulance to the hospital, they'll skip ahead of the line in the waiting room. But officials say that's not always the case.
Hospitals in any major event use a triage system. And that triage system is they prioritize who is the sickest, most significant patient that needs to be seen first. And that trickles down.
Doctors tell us patients with mild COVID symptoms are also causing congestion in hospitals and waiting rooms.
If you have mild symptoms, you're not short of breath, your fever is controlled, and you just feel a little under the weather, you should stay home.
Yale New Haven Health Dr. Tom Balsasic says if you are concerned about your symptoms, call your physician or primary caregiver and they can give you guidance.
If you have access to being able to buy what's called a pulse oximeter, that's a really nice tool to make sure that your oxygen levels are 95 and above. And if you are feeling well and your oxygen saturation is 95 and above, you're perfectly fine to stay home. There's no special therapy that they're going to give you in the emergency department.
Aaron Edwards, Channel 3 Eyewitness News.